Hi, I'm Dr. Siegel with Natural Transplants. Here I am with Peterson. He came in for his 1-year follow-up. First of all, the hairline looks amazing. Focused on this frontal hairline and the temple area. I couldn't even find the suture line, but we'll talk about that in a few minutes. Peterson, how was your experience? How fast did the year go by? Tell us what your friends are thinking.
They were surprised. They were very happy for me, and I'm very happy too.
Best decision you've ever made?
Best decision.
And the year flew by.
Yeah.
When did you start feeling comfortable with your new hairline?
I think about 4 to 5 months. It started to grow naturally.
And were you ever worried about the incision site in the back?
No. No pain. I mean, it was great. No?
Do you recall back a year ago when you actually had the procedure with us? Was it an enjoyable time?
Very enjoyable. Had a lot of fun. You guys were very entertaining at the time. Yeah, it was like you don't even feel like it was happening.
Now, you told me that you just got a haircut, so you normally wear your hair a lot longer than this.
Yeah, I had a wedding, so I had to cut it down a little lower. So.
And do you like it short like this, or do you like it when it's super long?
I like it when it's long.
Because it just fills in naturally and everything looks perfect.
Yes.
So you can wear your hair long, you can wear your hair short.
Yeah.
This is a perfect example of what we do here at Natural Transplants. You know, you came back out this way, obviously, for the 1-year follow-up, and I appreciate so much that you're willing to do a video to share your story. For somebody who's thinking about getting a hair transplant, what would you say to them?
You should go for it and try it and trust Dr. Siegel is the best.
Thank you for saying that. Again, I love what I do. I've had the hair transplant myself, and congratulations, you look amazing.
Right.
And you have my personal number if you ever need anything. I'm here, and look forward to you having years and years of hair on the top of the head.
All right, thank you very much.
Thank you
For your help.